Are we going to make it through payroll? We're using software to make the experience significantly streamlined. Healthcare is a long game. Oh, you're old. You don't want to use tech. When you're thinking about the patient, you'll always be rich. What if what the patient wants is what we should be focusing on? I'm not worried about the competition. I'm worried about building a great company. Because why is there no health tech for 100 million Americans? We're really focused on the easy, low-hanging fruit to build a fabric of convenience for patients.
Good morning, everyone, and I'm really pleased to welcome our new guest today. Her name is Dr. Renee Dua. Hi, Renee.
How are you?
Good. How are you?
I'm well. Great to be here.
Yeah, I have lots of questions for you and really excited to talk about most of them. Let's start with your short introduction. And how did you decide to get into the digital health startup world?
So, I've always been a little digital and obviously very health inclined, right? I'm a physician by training. I've been in a private practice for 20 years. So when you start your own practice, you have to be entrepreneurial. Doctors, especially doctors who go at it without the help of a hospital system or a payer system, they have a lot to figure out and learn. So when I started practice, within a few years, it became necessary for all of us to have electronic medical record systems. So I live in a part of Los Angeles that's huge called the San Fernando Valley. And I was one of the first physicians to set up the EMR in the office and actually use it meaningfully, such that I got money back for having done such a good job, right? And so that was my first real taste into, tech, let's call it, even though maybe many people don't think of EMRs as very tech savvy, right? But from there, I had a BlackBerry and that was my entry point into smartphones, and, how a phone can become a reliable best friend to helping you get tasks done, right? Achieve things on the go, sending a quick email, sending a quick text, reminding somebody of something, right? And it really was when I became a mother that I thought, you know what, I need an extra set of hands. And here I am, I have everything, right? I have an education, I have money, I have a partner, I have a supportive family. Like, what do people who don't have all the gifts I have do to get great care from their doctor? And it was a terrible experience in the emergency room with one of my sons that led me to, on a drive home with my husband, Nick, say, it's got to be easier for parents to get their children seen. Just because it's Friday night doesn't mean you should have to go to the emergency room. That's outrageous, right? We couldn't find an office, an urgent care that could help us. So from that story, we built a company called Heal. And Heal, which was started 8 years ago, was our destiny for Heal was that it be primary care in the home for all ages using software. And what we envisioned was that you had a doctor and she was a member of your community, but while she was in your house, she set you up with remote monitoring devices and she set you up with video telemedicine, one click, right? And you could see her and she could see what's going on with you, but she wasn't in your living room all the time, right? And obviously 8 years ago, this was way ahead of its time, right? We didn't have a pandemic to thank for all the boom into digital health tech you see. And we made a lot of great progress at Heal. We expanded into 12 states, $200 million of investment capital. And in the last year, Nick and I stepped away as Heal is very much in an operational state of growth. And we decided to work on the other end of the problem, which is, how do you make it easier for patients who are vulnerable to get all their care in one place, right? Nobody is going to sign into 12 apps to get their medications delivered, to be reminded to take them, to check in with their mental health professional, to look at their diabetes, blood sugars. That doesn't make any sense, right? So the HeyRenee platform, and literally Nick named it for me because this is what I do for my own parents. I organize all of their needs into one place. And I tell them, your blood pressure looks like this today. Did you take your medication? You need a refill? Let me get it done for you, right? I bring it all together for them in a human. But we're using software to make the experience significantly streamlined. So that's sort of my journey, which has been, a wonderful, wonderful opportunity.
Wow, that's really impressive. I just wanted to say that like lots of startup founders would be happy with what if they would accomplish with Heal and continue working on that project, but then you decided to move on and start a new chapter.
Yeah.
That's really great. Maybe you could tell a little bit about what are your plans for HeyRenee for the next 1 or 2 years?
Sure. For the next 1 or 2 years, we're really focused on the easy, low-hanging fruit to build a fabric of convenience for patients, right? Why are patients not getting better in America for sure? And it's really simple things. They need to be reminded they have an appointment coming. They may need a ride to that appointment. They may not know what medication to take just because their doctor prescribed it. If you're prescribed benazepril, sometimes it's a blue and white pill, sometimes it's a capsule, right? How do you make these things easier? Sometimes patients, we make assumptions. Oh, you're old, you don't want to use tech. That's not true. That's totally not true, right? Or you don't speak English. You probably don't text. Of course you do, right? And we looked at our patient population. Again, we're always focused on the underserved and vulnerable populations like children and seniors. And what we observed was, seniors are using WhatsApp. Seniors are using Facebook Messenger. When I was starting the ideas for HeyRenee, I walked into the room with my nanny, who's from Mexico, on Facebook Messenger with her mom, who lives in a Puebla in Mexico, and my then 2-year-old talking. It was the most unreal, super cool to see, right? How the world is connected, right? So we make a lot of assumptions. And so for the next 1 or 2 years, what we're going to be doing is really building trust with the vulnerable population that is seniors and delivering for them a fabric of these conveniences so that the simple things they can do to stay well are at their fingertips on a phone or on a web page. Now, if you were to ask me that question for 5 years, one of the things that's on my mind a lot is why is there no health tech for 100 million Americans, right? I haven't seen it yet, and I haven't seen, I think Amazon's trying, right? I think Microsoft's trying. I think there's lots to learn and failure. But what's the health tech that's affecting 100 million Americans? And I'd love to be the answer to that problem.
Cool. Just to clarify, is telemedicine going to be included in HeyRenee or already?
Absolutely. And again, this is a really important point because I don't think a senior who's not trustworthy of technology wants to see any doctor. I think they want to see their doctor. And if they're going to message or chat or video with somebody, they want it to be the person who already knows their information. So what's really critical on the HeyRenee platform is we understand a patient's insurance, their eligibility, and then we have single sign-on to their physician on a telemedicine platform. And by the way, their behavioral health specialist too, so that behavioral health specialist is going back to that PCP and saying, Dr. Smith, your patient has depression. I recommend you start an antidepressant, right? Maybe Dr. Smith missed it, didn't have time to evaluate it, didn't feel comfortable treating it, but now has the guidance from the specialist. And so part of our job is to communicate using these various, asynchronous interactions and putting them in one place for a patient to digest, the caretaker to digest, and ultimately for a physician to not feel bloated by, but, able to learn from.
If I understand correctly, right now, the doctors that are going to take part in the project, they are entrepreneurs, right? They're not, they have private clinics or.
They do. I agree with that statement. They're entrepreneurs. They're entrepreneurs. That being said, I think especially right now, but has been for a long time, the American expectation of what a physician does, certainly a primary care physician, is, on the part of an administrator or a hospital or a health insurance, is outrageous. Those doctors that are going into private practice are doing so with enormous guts, right? And those doctors that are working for a system are burning out. And you're seeing that. You see that in the news every day. Physicians and nurses and ancillary staff, technicians, they're leaving healthcare in droves. And this is a serious threat, certainly to me, but definitely to your generation, right? Who's going to take care of us? And so to some extent, the HeyRenee platform understands that we have to teach our caretakers and patients to take ownership for what their needs are, because their doctor may not be able to see them more than once a year, right? Or twice a year. This is something that's very much on our mind. So to answer your question, yes, these doctors are entrepreneurial, but more importantly, these doctors want support, right? These doctors have a back office they can barely afford, and we need to help, right?
In order to get 100 million patients on your platform, you need to partner with pretty much every doctor in the country, in every hospital. Is that possible?
I don't know the answer to your question, but I do know this. I do know that patients, and especially caretakers, have an interest in this service, right? I do know, and again, we've obviously done the market research, and we know, there is a consumer-facing trend with subscriptions and getting patients these conveniences. And I do think many of us are trying to solve this problem. And I mentioned Amazon, for example. You see the very cool implementations that Amazon is making as we speak, right? I think also, though, many people are trying to get into the health tech space. A great example is Uber, right? And Lyft. Both of these companies are trying to get into the health tech space. And it's bloody smart, right? Because they know that if they can help patients get to a scheduled appointment or avoid an emergency room, right? There's some skin in the game for them too. So I think partnerships and making friends and using this notion of a single platform for a patient to come to is brilliant, because I think the more partners we have, the more people will come to us to tell us what they need to build, again, this fabric of conveniences. And when it's so convenient, it's a streamlined experience. There's nothing to it. I firmly believe seniors, and then of course children, right, will be able to use this. Parents.
Well, I can see how you can, I guess, easily partner with Uber, but it's probably much harder to partner with some huge hospital. Do you need to talk to the administration or start with the lower level with physicians first?
I think that's a phenomenal question. And I think the answer to your question is both, right? So when you start working with a giant bureaucratic system, as you well know, it takes a very long time to build those relationships and get access to an API, a development environment and whatnot. But I also think that I want you to consider approaching it differently. What if what the patient wants is what we should be focusing on, right? What if the patient says, Dr. Smith, I'm using the HeyRenee platform and I'd like you to start using it too, And what if more and more patients are saying, I need you available in this way, hospital system X, right? All my information is here. My daughter is logged in here. My labs are ordered here. My telemedicine is here. It knows my insurance. It has my credit card. Come here. I think that's a very different way of looking at it. And so few times, unfortunately, do I really truly see a focus on what the patient wants. I think we're all talking about what the patient wants, but we're talking about a top-down approach. Go to the hospital system, go to the payer, focus on what they need to do to change. I think what they need to do to change is hard for them to accept, right? An insurance plan wants to sell plans. That's their focus, right? Maybe a little bit risk scoring, but their focus is in selling plans. Let's be clear, right? A hospital system, their focus is on length of stay. Get in, get out, right? Get the bonuses for doing it the right way. Is it really on what happens with that patient to make sure they don't come back? No, right? And I can tell you because I've practiced in a hospital for years, you know? So it's one thing to say what patients need and want. It's another thing to actually act on what patients need and want. And what we're doing is licensing patients to say, here's your stuff. What do you want? What do you want to see happen? And then, of course, it's on us to help them focus the change from the insurance level and the hospital, the risk-bearing entity level. That's on us.
Great. You've mentioned huge giants like Amazon, Microsoft, and there's definitely hundreds of smaller companies and young startups.
Yep.
Do you feel with all that boost in after the pandemic started, with all the investment in digital health, do you feel the pressure of the competition right now?
I would have to say that right now in the US, stock market is telling us a lot about unicorns, right? Here's what I really think. I'm not worried about the competition. I'm worried about building a great company. And I've always been focused on building a great company that will last the ages, that will develop and build improved outcomes and help people. I have been focused on this problem since I started medical school, college, frankly, or high school when I decided I wanted to be a doctor. Patients should get better, and I am a servant, right? As a physician, you know, and certainly where you're from, when people become physicians, right, they are in the business of service, right? I always approach everything from that angle. I am for the patient, so I don't feel the same competition because what I'm working for is a company that's going to last and help people, right?
So you're saying that, for example, one of your competitors just released a new cool feature that patients are really happy with. Would you make the priority for that feature in your product higher because of that competitor or no?
I would work with my product, my head of product, and we would define our roadmap, right? We have, of course, a roadmap. We are sticking to it. We think we see the future of what a patient's going to be demanding. And, you know, I think the question is, do I feel threatened? No. This is a humongous problem. And I don't think one company is going to be able to solve it. I think many companies are going to have to solve it, right? Salesforce is trying to solve it. Oracle is trying to solve it. Yesterday, Teladoc, you know, in their press released an announcement about a care coordination platform, right? And Teladoc's in some hot water right now, right? But they're doing what they can to their credit, right? So I think the real answer to your question is, when you're thinking about the patient, you'll always be rich, you know, and this is something I say all the time, right? You think about the patient, you will always be rich, right? Everybody has to step in to try to solve the problem of the patient. So I think, again, I don't feel threatened. I feel excited. I feel that what we are doing is being validated. And I feel that the approach we are taking is super exciting, hasn't been done quite this way. And let's see what happens, you know?
I love that point about working for patients and you'll always be rich. That's great.
Yep.
I'm sure lots of startups would probably do much better if they follow the same strategy as you do.
You have to decide, do you want to get rich quick, money, or do you want to get rich later, improve outcomes? You will make a lot of money improving outcomes. It takes time. And I've also said so many times, healthcare is a long game. We're not delivering a ride or a pizza, right? Or a makeup session. We're delivering a relationship. And, you know, maybe not gone are the days of like instant, you know, married in 90 days. I think there's even a TV show about it. Or my own parents, right? Who, you know, were arranged and are still married to this day. You know, maybe those types of things exist a little bit, but far more, we have lost trust, right? We have lost trust with our patient. And certainly certainly for patients who are underserved. They don't believe that their insurance really wants to help them. They don't trust their hospital system, you know? And so this notion of building trust, it takes time. And if we want to use software to do it, we better be very thoughtful about that long game. And that company that creates that experience for that patient, those companies, because I think more than one of us are working on those, we will be the winners, right? It's just not it's not a mixed session, you know. It has to be a thoughtful approach.
Okay. You've mentioned a little bit about the roadmap. Can you just tell us the process? How often do you change the priorities? How does that go in your startup?
So we are a team of 3 founders. There's our CEO, Nick Desai, who happens to be my husband. There's me. I had strategy. And so I, even before, had Nick fundraising and setting our direction, and we met Ali Cohen, our head of product. I had a vision for what I saw this fabric to be, right? And then, of course, our head of product, Ali, we sit down together all the time and look at our roadmap, and rarely do we change things. And the reason for that is, number one, we were very thoughtful when we made the roadmap. Number two, we're very thoughtful about Ali's time, right? Ali is a mother. She is a very talented product person, but she has a life, and we want to respect her team, you know, her designers, her UX people, et cetera, et cetera. And then, of course, we have engineers, and we want to be respectful of them. If we keep changing our roadmap, they keep, you know, struggling with what we're doing. And that's just not how you build a successful product, nor is it how you build a successful culture. So we stick to our guns. Now, do we ever reevaluate and say, maybe this was valuable, but as we're seeing the tides change, it's less valuable? Yeah, and maybe we, you know, downgrade it and bring something else up. But by and large, the fundamentals of what we have been doing have not changed. And our MVP is releasing here very shortly because we've been focused, right?
Well, let's talk about the money. Very interesting topic for lots of startup founders.
Absolutely.
If I found the correct information, HeyRenee has already raised $8+ million.
That's correct.
That's a lot for such a young startup. Could you please tell me how different it was to raise funds for Heal 8 years ago?
Absolutely.
And what are we doing now?
Yeah. When we started Heal so many years ago, it was a concept that needed proof. And I definitely think we proved the concept, but I also think this, for founders, is where it's very important to work with the right investors and have the right board and have the right customers, right? Again, to reiterate, what Heal would have been is a primary care for all ages, right? Heal has pivoted now into the senior care space, which I think is still interesting. But 8 years ago, when we didn't have a pandemic, it was very hard to, at least I found it hard as a founder, let me say it like that, to prove to our investors that there was reality in that mission, right? Now we have a pandemic and they're like, oh, right? But, you know, I think Heal has also tightened its service line a little bit, you know. Because we did some pretty great work at Heal, it was a lot easier to get HeyRenee funded. 2 seeds, to your point, right? We have investors that believe in us, that have been following us all along, right? That have known what we're up to. We've built relationships with those investors, right? Even those that invested in Heal, we have different ones now, very interestingly, but they may have passed on investing in Heal, right? Because again, they didn't see it, but now the lights turned on for them and they're like, wow, maybe Renee and Nick know what they're talking about, you know? So that business of finding the right investor that believes in you as a founder, it cannot be understated, you know? That business of creating a board that believes in the vision of their founders, it cannot be understated. Failure to do so will eventually derail you, period. Full stop, right? So I think for the founders that are listening, first, be building a great company, with a smart roadmap that's focused, right? Because those certainly we did things incorrectly at Heal, you can imagine, right, on a daily basis. But my learnings are build a great company, great idea, great roadmap, smart business plan, have revenues, have a revenue stream, right? This business of growing with no plan to ever make money, I have no idea what that is, but you're seeing the failure in that model right now in America, right? And then most importantly, partner with the right people, right? Partner with investors, and if you're using third party to create your product, people who get your mission and do not try to distract or derail. I think that is huge, right?
Was there a single day early years of Heal when you had issues finding the investments and you thought, okay,
All the
that's
time.
not going to happen?
All the time. Absolutely, yes. Difficulty running payroll, or scared we won't make payroll, or, what are we going to do for the next payroll, right? These are questions founders have, especially when they're, really pulling at straws to make something great work, right? But here's the answer to that question. If you believe in what you're doing, the answer is around the corner, And here's where I'd like to take a minute to just credit my husband, Nick, who, I make this joke about Nick that when you go to a fair or a festival, sometimes there are games, and there's this one game where the head pops up and you hammer it down, and it pops up and you hammer it down. That head is Nick. He cannot be beaten, And to have a CEO like that is a blessing and a gift, And by the way, this is why I'm not the CEO, because I want to be able to look to someone to say, are we going to make it through payroll, right? That's your problem to solve. I can help you with an idea, a direction, a plan, a roadmap, what patients need. You get it funded. You tell us the order you want to see things. You help us with the growth and the business plan, right? So that's especially for the CEOs that are founders that are listening. You can't give up. If you believe in your idea, you have to believe in it as though you did not commit a crime you are being accused of. Right? It's your life on the line.
Got it. And on the first day you decided to start HeyRenee, I suppose with all the reputation you had over these years, you had zero, you were convinced 100% that you're going to raise money for HeyRenee, right?
No.
No?
No. Because even though I think we had some success with Heal, I don't think Heal was, at the time we left, the wild success that some of the companies you are seeing right now, maybe perhaps even struggling, were, right? And again, once again, that's sort of a comment on maybe the mistakes we made in our own roadmap then, our own deliverables then, our own growth trajectory then. We knew it would happen, but we had to have more people believe it would happen. And then the pandemic came, right? So that pandemic has been, so many people are riding the COVID wave, right? So many companies are riding the COVID wave, which again is silly, right? Because COVID is starting to loosen up. Where, maybe it's not completely done with us, but certainly our government officials think we're done with it, right? So, building a great business, I think we did it with Heal, but we may not have made the right decisions to earn the belief and trust of our investors and our board, right? To show the rest of the community that we were so fantastic, right? So yes, we did get funding and we did have investors believe in us, but I never, I have a lot of doubt, I think, as a person. I have that self-doubt, And so I would not ever answer your question to say, oh yes, slam dunk. I just don't have that personality. I recognized and reflected on any mistakes we made at Heal, certainly before we left, and I didn't want to make those same mistakes again. And with investors, I was very honest about it, And those who said, oh, well, Renee's not full of crap, I don't want to invest in her, or I do, great. That worked out for me,
Okay. You've just recently were a speaker at the AI conference, and I know that AI should be a big part of HeyRenee at some point, but you need to have a lot of data in order to use AI. How are you going to get it, and when do you think you can actually do some predictions?
Yes. We are always collecting data. We have been collecting data, even when we started the company and started a pilot. And we actually have built tools internally to collect, just for exactly what you're describing, collecting data. And then ultimately, I think it's going to be a year, obviously, I don't think it will be more than 2, but the goal will be to have a clinical data scientist, right, who heads a program to look. And once again, and I cannot say this enough, the way we are acquiring this data is first by building trust, right? Because we are familiar that there are plenty of patients that do not want to share, or who feel ashamed to share, or whatever it is. And then that's not reliable data. So the very first thing we do, for example, on a patient who joins the HeyRenee platform, is we onboard them. And the onboarding is actually human, right? It's a human onboarding, so that we ask and get answers to so many questions that will help garner this data that you described, that will then give us the ability to make predictions, which is so important, automate features that are simple for them to, those very patients to not need a human do, and then ultimately become a trusted advisor through a tablet or a phone or an Alexa device, right? I don't need to text a patient, remember to take your blood pressure medicine this morning. Alexa can be scheduled to do it, right? So, but my patient has to trust Alexa telling her. And so those are the types of things we're working on internally.
Cool. My last question, I would ask you to give some recommendations or pieces of advice for other startup founders in digital health. Maybe any specific mistakes that you made and you don't want someone else to make that.
Yeah, that's a good one. I mean, if we are going to talk about mistakes, we need to extend, by a few hours. But in sum, what I would say is, 1, find the right founding team, right? It's a marriage. You're marrying these people. Most people, anyway, do not get married to then divorce, right? So find the right partners for your company. Find the right partners for your investment. They believe in you. You've had some drinks over dinner and really gotten to know each other, right? And then
smart money, right?
absolutely, especially in health tech. I've even seen, respectfully, the stupidest ideas get money, right? That's going to change right now. It's changing, And then the third thing I would say is, have a business model that grows and eventually makes money, right? You cannot have a business model that never makes money. It has to grow and make money. These would be the three things. And I think on a global scale, if you are a founder and you want to do something and your idea is great, then you have a responsibility to do it, right? You cannot just throw in the towel for any, Tom, Dick, and Harry reason. You've got to do it, right?
Thank you, Renee. Those are really great recommendations.
My pleasure.
I really wish you luck with HeyRenee, but I'm actually not sure you need luck. I think you're all set.
Oh, I think we need a little bit of everything. Luck, hard work, money. Yep.
Right. Well, I guess good luck then.
Thank you so much. Thanks for the opportunity. Great questions.
Thank you.